You want to make sure that your patient is kind of like, if they can't tolerate all the way flat, that's okay, but just kind of lay them back. The reason for that is when they're sitting straight up, it's hard to access this area. So you want to kind of lay them back so that this is nice and open, as far as they can tolerate, okay? Again, you're going to want to take in your supplies with you. So you do need a doctor's order for this. It's kind of like, most of the time it's like a generic bundle order that will cover like trach care, trach collar, suctioning, that sort of thing. And you want to make sure when you're going in, you want to make sure you have plenty of supplies. So trachs are in there, same size and size down, ambu bag, multiple tracheostomy care kits, multiple packs for suctioning, sterile water, extra trach collar and corrugated tubing, and this will be hooked up to the all-purpose jet nab. So you want to make sure you have extra all-purpose jet nabs in there as well. There's the drainage sponge. It's the one with the slit in it. You can hold it up to the light and see the slit, because there's like, is that a 4x4? Or that's a 2x2, right? That's a 2x2, right?
I think
4x4.
4x4.
4x4 would be bigger, right? What's the one that's like this?
The one that's like this.
It's the same size as a drainage sponge, but you hold it up to the light and there's no slit. But that can be useful if you need that to clean around. So, because not all hospitals are going to necessarily carry the trach care kit. So you want to have the supplies that you would need that came in here. So the sterile water, the gauze, the drainage sponge, so that you can clean everything appropriately. And intercannulas, I forgot that. So you need more intercannulas if it's a non-disposable. But remember, we're learning today as if it is a non-disposable intercannula. All right? Sound good? So we've got our order, we've checked our chart, we've got our PPE on. These are not normal. Pre-COVID, we don't walk around with face shields and eye covering. Okay? We don't walk around with masks. When you go in to do trach care kit, even if they're not on droplet precaution, you're going to want to protect your eyes. So make sure you get a face shield, or there's masks that have a face shield attached to it, because your eyeball is a mucous membrane. I've had blood go in it. That was not my blood. Okay? So you don't want it to happen. Trust me. All right, so I've got my PPE on. I walk into the patient's room. Hi, I'm Stacy from Respiratory. I'm just here to do some trach care on you and take a look at your trach. Rest assured that most of the time I've always suggested that during testing we have you do trach care and then suction in the middle, and I've always been shot down saying it was just too much. But rest assured, in real life, most of the time you're going to have to stop trach care, and suction, and then go back to your trach care. It's just because it jostles the trach around and it induces a cough. Okay? All right, so we're in the room. We have all of our supplies. This is not what sterile water looks like in the hospital, but we're going to simulate it here. So I have my sterile water. I have my extra Dale trach holder, which will come in like a plastic packaging. There'll be a bunch of those in there as well. And you want to make sure you have extras, because if the patient has a lot of secretions, these easily become saturated. Okay, so I have my new trach care collar. Tracheostomy collar. Okay. You're going to want to I like to use the bedside table. All right, because you can move it around. It's like a nice space for you to use. I'm just going to use the table for today. And you want to make sure that you have your trash can nearby. You're going to save your kit just like with your suctioning, so you can keep practicing it. But in real life, if you have a soiled anything, it's going right in the trash. Okay? All right, sounds good. So I've come in. I'm going to assess my patient. I want to see how they are before the procedure so I can compare it to afterwards. So breath sounds, vital signs, level of consciousness, their color, their SpO2, their temperature. Are they alert and oriented? Can they follow commands? Do they have any signs of distress like AMU, retractions, diaphoresis, tachypnea? Okay? Once I'm satisfied with my assessment, then I'm going to go into my trach care. Sound good? All right. Okay. So first and foremost, now remember, everything inside of here is sterile. Okay? So I'm going to go over here And I'm just kind of like checking it out too while I'm doing this. And I'm just going to very gently remove the old drainage sponge. This is nice and clean and beautiful. Most of the time, this is going to be saturated with different colored sputums, you know. So I'm going to throw that in the trash, okay? Now I'm going to come over and I'm going to make sure they're on their oxygen, all right? Okay, I'm just going to get set up, okay? So I like to make sure that this is underneath the patient and ready to go. Sometimes they can lift their head, sometimes they cannot, and you have to just kind of fish your arm underneath. Make sure that your Velcro is in the right position, okay? Okay, I'm gonna open up my sterile water, date it, put my signature or my initials on it. That's ready to go. So first and foremost, I have it open. I'm going to very carefully, I mean, for lack of better terms, it's like a dental napkin when you go to the dentist. And you're just gonna slowly open it up, okay? And you're gonna kind of, oh, these are so old. All right, I'm just gonna kind of work the corners so that I can maintain sterility on the inner edge, on the inner inside of the napkin, okay? So by rule of thumb, just to make it easier, if you can't do it this way, that's okay. See how there's a shiny side and a dull side? Shiny side goes down. So just like that. Okay? Then I'm gonna pick this up. I can't touch this too, but I'm gonna aim for the middle. See how there's like a middle set of squares and then there's an outer set of squares? I'm gonna aim for the middle set. And I'm just gonna very gently, you can't touch it like this. That breaks your sterile field. So I'm just gonna go, boop. Did everything come out? Excellent. I'm going to get my sterile water and fill up all of my chambers. Okay? Next, I'm going to get my dish. This is my dish, my inner cannula, all right? Oxygen back on, and you're just gonna very carefully drop it in the sterile water. Going to retrieve my sterile gloves, okay? And now I'm gonna get sterile. Left, right. When you open these up, you're just kind of like scooting your fingertips underneath the cuff and then opening up. You're not sterile for very long with this procedure. So it's not as intense as suctioning, but I'll be able to tell if you've been practicing, okay? So remember the first one, how do we pick up the first sterile glove?
Pinch.
Pinch the cuff, yes. I'm gonna pinch the cuff. Okay, I believe my thumb is over here, okay? Okay, how do we get the second one on?
Scoop.
Scoop. So you're gonna scoop your fingers under, okay? And remember, this one is sterile, so this one's like a little bit easier. Oh no, was my thumb over there? Good God. But you know, it is what it is. This happens all the time. I think that's my thumb. Yeah, okay. Boom, sterile, okay? So now I can touch everything in here, right? So I'm gonna separate everything out. These are garbage. Those are the Trach Care ties I was telling you about. Here's my drainage sponge, and you can tell because it has the slit down the middle. So I want to kind of just like lay everything out. I think that you have 2 gauzes. This one has 4, but just for the sake of consistency, I'll only use 2, so it's the same as yours, okay? Also, you have pipe cleaners in yours. You have 2 pipe cleaners. I do not have them in this one, but that's okay. I'll show you how, I'll instruct you how to use those. So I have this set up. I'm going to take my Q-tips, and they're going to go in the smallest bin of sterile water. This is called, I think, like a bristle brush. All right. And now I'm going to do my dish. So I'm going to very carefully retrieve this. And you don't want to clean this over top of your sterile field because like goopy gobbies are going to be coming out of it. So you want to kind of clean it over the trash. All right. Get the outside, inside and outside very good. This is gonna be just a mess. You might need to get some more water, okay? And you wanna just scrub it really good. Sound good? Okay, here. Next, in the next biggest basin, or the second largest, yeah. You're gonna drop it in, kind of let it like rinse off a little bit, okay? Pick it up, get one of your 2x2s, just one. And that's what we're gonna use to dry it, all right? So you gotta dry it really good on the outside, all right? You're gonna tap, get the droplets out, okay? Trash. This is when you would take your pipe cleaner and put it through it to get like those little additional droplets. And you would kind of like twist it around and then that would go in the trash, okay? So now we're almost done being sterile. So with my dominant hand, I'm gonna reinsert the inner cannula. And with my non-dominant hand, I'm gonna move the tray collar aside, okay? So I move this aside. Okay, I'm just gonna put your inner cannula back in. And so it pretty much just like drops right in. Then you have to twist it to the right until you feel it click to lock it in. Done being sterile. Not as bad, right? Okay? So now we have to address, this is when you'll, in your clinical site, you'll make a clinical decision whether you want to clean the site first or if you want to change the Dale trach holder. You don't always have to change the trach holder. It depends. If it's saturated, are you going to change it?
Yeah.
Yeah. But if it's not, we're not going to change. If it's not like, you know, old or crusty or saturated, you can use it until next time. Okay? So that's where you make that decision. For today, I'm going to change the trach holder first. No. I'm going to clean the site first. And then I'm going to change the trach holder. But you can manipulate that order. It really depends on your patient. Our mannequin Stan, he's nice and clean. We can kind of do whatever we want. But you can do either or in the clinical. But for today, we'll clean the site first, then we'll change the trach holder, then we'll put in the drainage sponge. But we're a clean procedure right now. Sound good? Okay. So I'm going to take my other 2x2, and in the last basin that wasn't used for any rinsing or anything, I'm going to dip that in the sterile water. Make sure I wring it out real good so we don't drown our patient, okay? I'm gonna come over here, move this aside. Okay, I'm just cleaning up your trach. So you wanna really clean the flanges really good. You can kind of tip this forward a little bit and tip it back. You're not pulling on the trach. You wanna be as gentle as possible, okay? All the while you're taking note, is there any redness, any sores, any oozing or pustulent sores? Any foul smell, okay? Because you're gonna wanna report that. All right, very good, trash. And then I'm gonna take one of the Q-tips and I like to slide it down under the flange and just kind of sweep it out in case I miss any goopies under there, okay? Then you do the same thing for the other side. Just kind of slide it down, not into the stoma, just under the flange and sweep it out like that. You may need more 2x2s, and that's why you want to have them in the room, ready to go, okay? So now we're ready to, I've finished the trach care, I've taken note of the site, give my patient his oxygen back. Now we're gonna get ready to change the trach holder, the Dale trach holder. What's really important here is that from the second you undo one side, is that you constantly do not hold and stabilize the trach until you have refastened both new sides. Because they could cough that airway right out. I'm not even kidding. And it would be just, you don't want to be at the epicenter of that. Just trust me. So don't let go, okay? All right. Okay, so I'm just gonna change your trach holder now. So I'm gonna slide that up over here. I'm gonna stabilize. Don't go like this. What am I doing at this point? Suffocating the patient, okay? So just to the sides, I'm gonna undo one side and I'm gonna reattach the second. So these are pliable, so you can kind of like manipulate it. Do you see what I mean? All right, I'm just gonna give you some oxygen, but I did not let go of the trach. See how I'm still holding on to it? You're doing a great job. Okay, now I'm gonna do the other side. So this one, and you do have to like use your fingers and use your thumbs, and I mean, it is what it is. That would go in the trash, but we're not throwing this away, okay? All right. And you're gonna do your second side. And see how I kind of pick the flange up a little bit? All right, good. Some oxygen. Don't let go yet though, because you don't know. You wanna be able to fit 2 fingers in there. So it's pretty snug, okay? If you need to adjust this part over here, comes undone. Well, I'll show you on this one. Sorry, Stan. Give him his oxygen. There we go, okay. But see how this can come off? So you can like shorten it or extend it. Not everyone has the same size neck, right? So you may have to cut it. You may have to put this at the end so it's nice and long. This may have to go as far as it can without cutting it if they have a smaller neck. So you can manipulate that if it's still not tight enough or still too tight. Does that help? Okay. So almost done. Last thing we're gonna do is we're gonna put the new drainage sponge in, okay? Okay, Mr. Stan, next I'm going to, now this patient has a cuffed tracheostomy tube, so you have to make sure that you keep this out from under the bandage. Okay? In other words, you can't put the drainage sponge over top of it. You wanna have that out. So the way I like to put in the drainage sponge, and it's the easiest way I've ever found in my entire life, and I've done a lot of trach care, is first slide it underneath of the trach holder on the side, like that. Not under the flange, and then just shimmy it under. Whoops, come back here. Give the patient some oxygen. Okay, all right, almost done. Make sure this is outside, okay? And then same thing on the other side, just slide it under the holder, okay? Doing your best not to like wiggle too much because it makes the patient cough, and then shimmy it under the flange. Then you just wanna straighten it out like a bow tie, okay? Now we're all done. So I'm just going to reattach your trach collar, okay? Try your best to keep your face out of the line of fire, okay? Then you want to reassess your patient to make sure you didn't cause any harm, that you didn't dislodge the tracheostomy. So again, breath sounds, vital signs, level of consciousness, SpO2, patient subjective. If they're not able to talk to you, they can go like, yeah, no. If you had to suction them, you want to take note of the secretions, how much, what was the color, what was the consistency, right? Any signs of distress like AMU, retractions, diaphoresis, tachypnea, right? Once you're satisfied everything is okay, sit your patient back up. If you raise the bed to save your back, I'm short, I'm a shorter person, so a lot of times the bed height is okay for me. But if you're taller, raise the bed up, don't break your back. Just make sure you put it back down and raise the head of the bed back up to where the patient's comfortable. All right, you're gonna take note of where the water level is on your all-purpose jet neb, what FiO2s are on, what the tubing looks like. If this is soiled and disgusting, what are you gonna do?
Change it.
I mean, it's not rocket science. Don't leave it, all right? If your drainage bag is full of water, are you just gonna leave it? What are you gonna do?
Empty it.
Drain it. Like, you know, you can take, I like to take a glove. Let me see if I can show you with this. And where the little stopcocky thing is on the drainage bag, you wouldn't be taking it off your hand. You would just get a new glove. I like to open the stopcock and I drain it into a glove. And then close the stopcock because you can lose oxygen through it, and then take it to the sink. Okay? And then clean up your area. All right? Make sure you have adequate supplies at the bedside. Then you, oh, I did a lot of lunges. Then you would leave the, once you're satisfied, everything is okay with your patient, you leave the room, you're gonna document everything that you did. If there was soreness or redness, you're gonna contact the doctor and make sure, or just double check, is there an order for like an antibiotic cream? Because you don't wanna leave an infection going right at the airway. That's like worst possible scenario, okay? And that's pretty much it. You know, some hazards, you can cause decannulation accidentally, bleeding, trauma, hypoxemia if you leave this off for too long. Yeah, make sense? Okay, so remember, so that's kind of it.